Understanding and caring for vaginal health is an essential aspect of overall well-being for anyone with a vagina. Yet, it is often shrouded in mystery, discomfort, or embarrassment. The truth is, being familiar with your own body is empowering. By learning how to examine your vagina and understand the signs of good health, as well as possible issues, you can take proactive steps to maintain comfort and confidence. This comprehensive guide will walk you through what you need to know about examining your vaginal health, recognizing normal and abnormal signs, and when to seek medical attention. Let's begin by understanding the basic anatomy. The vagina is an internal muscular canal that connects the vulva, the external part of the female genitalia, to the cervix, which leads to the uterus. The vulva itself includes several structures: the mons pubis, labia majora, labia minora, clitoris, urethral opening, and the vaginal opening. Each part plays a unique role in your reproductive and sexual health, and each can be affected by various health conditions. Regular self-examinations can help you become familiar with your own anatomy, notice changes early, and foster a sense of ownership over your health. Importantly, a self-examination is not a substitute for regular gynecological exams, but it is a valuable supplement. Before you start, make sure you're in a comfortable and private place with good lighting. You'll need a hand mirror, clean hands, and perhaps some lubrication if you plan to examine inside the vagina. Take a few deep breaths to relax. There's no rush and no right or wrong way to do this. Begin by observing the vulva. Gently part the labia majora, the outer lips, and then the labia minora, the inner lips. Notice the color, texture, and any asymmetry. It's normal for the labia to be different sizes, shapes, or colors. What's important is to look for new bumps, sores, or discoloration that are unusual for you. You may also see hair follicles, small sebaceous glands, or even tiny cysts, which are usually harmless. Next, locate the clitoris, a small sensitive organ at the top where the labia minora meet. The clitoral hood covers most of the clitoris, but you can gently retract it to check for any redness, swelling, or discharge. The area should not be painful to touch, though it is sensitive. Moving down, you'll see the urethral opening, a small slit or hole just above the vaginal opening. This is where urine exits your body. Ensure there is no swelling, redness, or discharge from this area, as these may indicate infection. Below the urethra is the vaginal opening. The hymen, a thin membrane, may be present in some people, but it can be stretched or torn through various activities, including exercise and tampon use. The vaginal opening itself should appear moist and pink, without any foul odor, unusual discharge, or lesions. If you feel comfortable, you can perform a gentle internal examination. With clean hands and short, smooth fingernails, insert 1 or 2 lubricated fingers into the vagina. The vaginal walls should feel soft, a bit spongy, and moist. You may notice ridges or folds called rugae. These are completely normal and allow the vagina to expand. Gently press around the walls to check for any lumps, tenderness, or areas of discomfort. If you feel a firm, round bump at the top, that's likely your cervix. It might feel like the tip of your nose. Take note of vaginal discharge. It is normal for discharge to vary throughout your menstrual cycle. Typically, it ranges from clear and watery to white and creamy, depending on hormonal changes. Around ovulation, it may be stretchy and egg-white in consistency. What's important is to recognize your normal pattern so you can spot changes. Signs of abnormal discharge include a strong, unpleasant odor, a green or yellow color, or a cottage cheese-like texture. These can indicate infections such as bacterial vaginosis, yeast infections, or sexually transmitted infections. Odor is another aspect to be mindful of. A mild, musky scent is normal and varies among individuals. However, a strong, fishy smell or persistent foul odor may signal an imbalance or infection. Likewise, itching, burning, or irritation are not normal and should be evaluated if they persist. Sometimes you might notice small bumps or cysts on the vulva or around the vaginal opening. Most are benign, such as Bartholin's cysts or sebaceous cysts, But any new, painful, or rapidly growing lump should be checked by a healthcare provider. Menstrual cycles impact vaginal health as well. It's normal for your vulva to feel more sensitive around your period, and for discharge to change. Track your cycle and note any changes that don't fit your usual pattern, such as bleeding between periods, very heavy or very light periods, or bleeding after sex. Sexual activity can also affect the vagina and vulva. After intercourse, some temporary redness or minor swelling can occur, but it should resolve quickly. Persistent pain, bleeding, or discomfort after sex are not normal and should be discussed with your provider. Beyond the physical examination, consider your overall vaginal health habits. Good hygiene is essential, but it's easy to overdo it. The vagina is self-cleaning, and using harsh soaps, douches, or scented products can disrupt its natural balance, leading to irritation or infection. Instead, wash the vulva gently with warm water and, if needed, a mild, unscented soap. Always wipe from front to back to prevent spreading bacteria from the anus to the vagina and urethra. Clothing choices also matter. Tight, non-breathable fabrics can trap moisture and increase the risk of yeast infections or irritation. Choose cotton underwear and avoid wearing damp clothing for extended periods. Safe sex practices are vital for maintaining vaginal health. Use condoms or dental dams to reduce the risk of sexually transmitted infections. Get regular STI screenings and talk openly with your partners about sexual health. Now, let's discuss some common vaginal health concerns. Yeast infections are frequent and cause itching, thick white discharge, and redness. Bacterial vaginosis often presents as a thin, gray discharge with a fishy odor. Trichomoniasis, a sexually transmitted infection, may cause frothy yellow-green discharge and discomfort. Human papillomavirus, HPV, and herpes can cause warts or sores. If you notice any of these symptoms, seek medical advice for proper diagnosis and treatment. Painful periods, chronic pelvic pain, or pain during intercourse can be signs of underlying conditions such as endometriosis, fibroids, or pelvic inflammatory disease. These warrant medical evaluation, especially if they interfere with your daily life. Cervical health is another key aspect. The cervix is not usually visible during self-examination, but regular Pap smears and HPV testing are essential for detecting early signs of cervical cancer or precancerous changes. Follow your healthcare provider's recommendations for screening intervals. When should you seek medical attention? While many minor issues resolve on their own, there are times when expert care is needed. Contact your healthcare provider if you notice unusual sores, persistent itching or burning, new lumps, abnormal bleeding, pain during sex, or changes in discharge that don't improve within a few days. Mental and emotional health also play a role in vaginal well-being. Anxiety, stress, and trauma can impact your relationship with your body and sexual health. If you're struggling to feel comfortable examining yourself, know that it's normal and okay to take your time. Seeking support from a therapist or counselor can be invaluable. Regular gynecological visits are an important complement to self-exams. A gynecologist or qualified healthcare provider can perform more thorough evaluations, screenings, and answer any questions you may have about your body. To maintain optimal vaginal health, practice good hygiene, wear breathable clothing, stay hydrated, eat a balanced diet, and be mindful of changes in your body. Probiotics and a diet rich in fruits, vegetables, and whole grains can help support a healthy vaginal environment. Avoid smoking, as it can increase the risk of infections and certain cancers. Remember, every body is unique. What's normal for one person may not be for another. The key is to know your own baseline and to be proactive about any changes. There's no shame in being curious about your own anatomy or in seeking help when something feels off. In summary, examining your vagina is a straightforward and empowering act. By becoming familiar with your anatomy, paying attention to changes, and practicing good health habits, you take a vital step toward overall wellness. Trust your instincts and never hesitate to reach out for professional advice when needed. Your body deserves respect, care, and attention, and so do you.